Joining me now from the Simkin Center is the CEO, Laurie Cerqueti. Thank you so much for being here with us on the CJN Daily.
Thank you, Ellen. I'm glad to be able to join you today.
Well, I'm glad to have you for an update on a story we hoped we wouldn't have to talk about. It's been a year, really, I guess, since COVID slammed the nursing homes and long-term care homes. When did you first learn that this had been turned into an outbreak?
It would have been right around the new year. In Manitoba now, it has to be 2 cases that are linked together that would be considered an outbreak here in Manitoba. So it was right around the new year that we were notified that we had 2 linked cases of COVID, and therefore we could declare an outbreak. And of course, since then, there have been many other cases that aren't necessarily linked to the center, but have definitely had an impact on our staffing.
In other provinces, the rules are that, or at least have been, that staff can't work in multiple places in order to try to contain contagion. What is the situation in Manitoba, and was that a factor?
So at one time in Manitoba, that was the rule, that you couldn't work in more than one place. But as soon as vaccines started getting introduced, if you were a double vaccinated staff, you could apply for status to work in more than one home.
And was that a factor here, as far as you know?
I don't believe so, no.
So it was, where was it community spread, or somebody got it while they were here from other people that were in? Do you know how it ended?
We believe most of the cases were community spread.
Mm-hmm. And so what does it look like now? You've come through 2 weeks, almost, a week and a half. What does it look like now?
It's really day by day. Today, I would say, and probably the last couple of days, it's been a little bit more stable, but that of course can change at any time. We do have what we call our work short plan. That is kind of a well-established plan that we have if we are going to be short-staffed, what kinds of things we would do to make sure that we give the residents the basic care that they need. So it might be things like their bed didn't get made that day, their bed would only be changed if it was soiled. We've moved to a pandemic menu, so to not have as many dishes, we use disposable like styrofoam plates and things like that. So it's things like that, just to make the workload a little bit less for the staff here, and that we're able to do the really essential things that residents need.
This time it's the staff. You had one resident that was ill. What is that still the case, or is it spread to residents?
That's correct. We are aware of one resident that has contracted COVID, and we actually have a separate unit that we open up when one of our residents gets COVID. So we take them off of their usual unit. We have them in this special area where there's dedicated staff looking after them. So that reduces the chance of cross transmission and other staff and other residents catching COVID. And it also makes the staff on the units that are still working with people that aren't sick with COVID feel a lot more comfortable in coming to work.
Do all the staff have their double vaccines? Triple, even boosters?
Probably 99.5% of our staff are double vaccinated. The remainder test on a very regular basis. So I'm actually quite proud of what we were able to accomplish with that.
So what do you need?
What do we need? We need staff. That would be really great. Unfortunately, the WRHA and government,
Winnipeg Regional Health Authority.
Winnipeg Regional Health Authority wasn't able to provide us with any extra staff. The staff we have here have been absolutely incredible. Every leadership team member and the staff providing the care and doing the cleaning, they've all gone above and beyond to pick up extra shifts, work overtime, and do all of those kinds of things. We have a very dedicated group of volunteers that will come in and do things like folding isolation gowns, assisting with feeding if we need it, helping residents FaceTime their loved ones that aren't able to come. And we feel very strongly that designated caregivers, so each resident can pick 2 people to still come into the center and visit and help. So those people that come in might help with feeding, they might just sit and keep the resident company and do things like that. So all of those things put together have kind of helped us maintain a safe environment. Not perfect, but I think the best we can do in a very difficult situation. So I'm very proud of what we've been able to accomplish in a very difficult time.
Do you need the Army? Do you need, I've seen that you people have called out for, retired health workers to help out. Do you still need that? Or because how are the staff who have been sick, are they coming back? Like, what's the balance? What's your numbers like?
So as of yesterday, we had 24 staff test positive, and 8 of them have been able to return to work, and that's going to change every day. At this point, I don't think we need the Army called in or the Red Cross. We've been able to kind of maintain with what we currently have, but definitely it changes all the time.
You sound like you're not feeling great either.
It's dry. It's dry in here.
Mm-hmm. So how does this compare to the height of the pandemic in 2020, end of 2020, early 2021, when you lost, 11 residents, but the staffing was there, So what about now? How different is this?
I would say that this go round has been more intense as far as staffing, so I can put it in a pretty easy perspective to see it. In the span of our 7-week outbreak, which was in the second wave, kind of October, November, December of 2020, we had less staff sick than 1 week of the outbreak this time. So that's how intense it has been.
Are you sleeping there too and working extra shifts yourself?
Extra hours for sure. Some of the leadership team has slept here for sure.
Mm-hmm. And so there's designated caregivers allowed in, but everybody else is still in lockdown as far as going in, going out, right? Right now, that's how we are at still?
Yeah, that is the way. Some of the homes aren't letting designated caregivers in, which we actually feel very confident on our designated caregivers. We put them through training so they know how to use the PPE, that they know how to assist with meals if that's required. So I don't think that they're any more of a risk having them in than our own staff at this point, just given the community spread out there. And they give us extra hands to support the residents.
All right. I saw some posts on your Facebook pages of the residents with these very poignant and also funny, but also poignant signs. Whose idea was that, and how did that come about?
It was probably recreation. The recreation department's been very creative, and we've found that using Facebook has been a really good tool to show the outside world what is actually going on here when they can't be here. So yeah, it's the best we can do right now, so everybody can see what's happening.
As far as government resources, a bigger picture, what do you think is going to look like at Simkin? While this is going on, what do they need to know, the government, what they need to do?
We've requested assistance with staffing, and they have not been able to provide that at this time. I don't know if that will improve or not. I don't believe any redeployment has actually taken place. So at some point, I hope that does happen, so that not just our site, but all sites can have the help that they need.
Yeah, because this is, we've been here before. It's not our first rodeo, right?
And that's, I think, some of the disappointing part for me is that we were very prepared, but it doesn't seem like the system was all that prepared, even though this is like our 4th go round.
Mm-hmm. All right. Well, I wish you the best under the circumstances. Is there anything that you want our listeners to understand that I didn't ask?
I think just that our staff have been absolutely amazing. Our families have been amazing and supportive. The Jewish community has been amazing and supportive, both with being physically here, but also through donations. So really, I think we're probably better off than a lot of the homes just because of the community that we have.
Okay, I've been speaking with Laurie Cerqueti, CEO of the Simkin Center. Thanks so much again for being on the CJN Daily and giving us this update.
Thank you very much, Ellen.